I
Sorry.
during that I also started preparing for steps, and then I came to the United States, and in 2001. I've been in the US for about 23 years, and I did my residency and um, then boards in general pediatrics as well as in pediatric hospitalist medicine. So, but I usually come back every 1 to 2 times every year and to teach and to train people in different pediatric objectives. For example, neonatal resuscitation program. I just came back uh, last night from um, from my tour in Pakistan. Thank you.
Thank you for that. So just some noteworthy contributions and initiatives of Dr. Kamal. He founded a Facebook group for Pakistani pediatricians. He established Apna Pediatrics, and he has a special interest in breastfeeding support, rational drugs use, and applications of AI in pediatrics. So, Dr. Kamal, would you like to discuss Apna Pediatrics?
Yeah, so APNA stands for All Physicians of Pakistani Descent in North America. Initially, it was founded in Michigan as Kemkana from King Edward Medical College Association of North America. But then, as more medical college alumni joined, it was changed to all physicians of Pakistani descent of North America. And Dow forms one of the largest, I think it's the largest group right now. Then uh, we felt that there were different groups like Apna Michigan, Apna Ohio, um, that was classified according to the states. Apna California, Apna Alabama chapter. Then there was also Apna groups according to the medical college, like King Edward alumni, Dow alumni, Exeter alumni, which are very active. However, there was no pediatric group as such. So we wanted to establish that, and so I had started talking to the Apna leadership back in 2011, 12, 13, 14, and then in 2015, finally this group was formally recognized as a specialty network of Apna, and so Apna Peach was founded, and the aim was to get to know each other in North America, all the pediatric alumni, who is who is working where. In addition, we wanted to connect with the pediatricians from Pakistan. So that was our second aim. And the third was to promote research in pediatric medicine. We followed Professor Zulfikar Bhutto's guideline, and he has very accurately pointed the direction for us. Like the main problem in Pakistan is very high infant mortality, and the biggest chunk of that is the neonatal mortality. So many newborns are born, they die on the same day they are born. And one of the biggest reasons is neonatal asphyxia. So whenever a baby is born, uh, the doctors and the nurses taking care, they start cardiac massage right away. In newborns, um, the main um, way goal is to establish ventilation. So once we have the ventilation, the cardiac massage can wait. And this is different from the rest of pediatrics and adults in which the cardiac um, resuscitation is number one. and the pulmonary is number two. So in newborns, the pulmonary ventilation is the first. Thank you. Go ahead.
All right. Thank you for that, Dr. Kamal.
So
So,
now we have more than 100 lifetime members of Apna Peeps. We
mhm,
have all the specialties like Apna Cardiology, Apna Neurology, and
mhm.
we help establishing ties and bonds with the Pakistan Pediatrics Association. So just recently, few days ago, a memorandum of understanding was signed between the PPA and the Apna Peeps.
Okay. Congratulations for that.
Thank you. Mhm.
All right. So now we have a few questions for Dr. Kamal. So first of all, pediatrics itself, when an IMG views pediatrics, we are told that it's not a very competitive specialty. Do you think that is true?
That's quite true because the pediatrics is the lowest paid specialty in North America, lowest paid. And so many of the US graduates, they try to go for the higher paying um, specialties like orthopedics and um, dermatology and what whatnot. Now, the two types of US graduates, they go for pediatrics, two or three types. One who they have a passion and they just go for the pediatrics because pediatrics is one of the most satisfying and rewarding um, professions anywhere in the world. And so people, even in North America, people realize that and they like to go. Okay. And for them, the money is not very important. Second, a smaller group is of US graduates who belong to extremely wealthy families, and they enter pediatrics just because, again, they like it a lot. Third group is, of course, um, whose merit is a little bit low, and they would they like to go there because it's not very competitive. So the field is very much open for international medical graduates.
Okay, perfect. So just shifting gears back to Apna Pediatrics, we have a couple of questions about that. So
Mhm.
we were wondering if there are any opportunities that Apna Pediatrics has for medical students.
Yeah, so we have set up different groups for residents and applicants. Um, so we would very much like to involve medical students as well. As of now, we don't have a dedicated group, but this was one of our dreams and goals to involve medical students. So I would very much like to set up a group just for medical students.
Perfect.
So
Okay,
I'm very happy with your enthusiasm and interest.
thank you so much.
Mhm.
So next, we would like to ask about what opportunities there are for research. I think you mentioned that Apna Pediatrics is also active in research, so we wanted to know about that.
One more time, can you repeat that?
So we were wondering if Apna Pediatrics has some sort of research opportunities. Um, is there any opportunity like that for medical students?
Definitely. I mean, it depends on which field you are interested in. So, which field are you interested in most?
So subspecialty you're talking about?
Correct.
So for me personally, it would be infectious disease, but I know there are quite a few people interested in other subspecialties like cardiology, dermatology, etc. Uh,
Mhm.
so it's quite
So
vast.
we don't have a pediatric dermatologist as such in
Mhm.
our group as of now. Look, there are dermatologists in US who are Pakistani, who have Pakistani descent. For example, the newest elected Apna president is Babar Rao. He is a Rawalpindi medical graduate, and he is very active in research.
Mm-hmm.
And so it would be good to connect with him, but he's not a pediatric dermatologist.
Mm-hmm. So, what type of subspecialties do you have research opportunities in?
Well, we have all the specialties. The main thing is that your group is the very first one who has reached out and connected to us. So I'll be happy to connect anyone who is interested. For example, we have a lot of ID, infectious disease specialists, and they are very active in research. So depending on if you want to do antibiotic stewardship or something else, well, if you like to collaborate on some um, simple things like hand washing and its effect on reduction of infection rate in Pakistani hospitals, that would be good. So we can connect you to all the interesting, like the relevant faculty.
Perfect. Perfect. All right. So does Apna Pediatrics have any sort of mentorship program for medical students?
Not right now, but we can, start working on it.
All right. And last question for Apna Pediatrics. Is there any way that clinical electives or observerships can be set up?
Well, that is one of our groups is already geared towards that, and I think you might be a member of that. So, but that is mostly for people who have already completed the the MBBS exam
Okay. So observerships in general, right?
in general. But the other issue is that in the US, I used to help out a lot of students, myself, electives, observerships. But now I am with Henry Ford Healthcare, and they don't allow any foreign students, observers, electives.
Mhm.
Unfortunately, most of those positions are very expensive. So they charge a lot.
Yes, that's very true. All right. So do you see any common problem or any common mistake that pediatric match applicants do?
Yeah, lack of networking. For example, I met a candidate who has not um, been successful in any match. And the reason is he applied to very highly prestigious places, which do not take any international medical graduates. So he
Mhm.
applied, for example, to two of the top places in Michigan where I belong,
Mhm.
and he never applied to the three that were rated lower, but they were very IMG friendly. So I talked to them and I suggested that to him to apply to those other places also.
Mhm.
And this time he was successful in getting two interviews.
Wow, mashallah.
Mhm.
All right. So, you have been in the United States for a while. You have exposure to quite a few places. What places, in your opinion, are IMG friendly for pediatrics?
Well, on the top of my mind, I don't know, but they're like East Coast, New Jersey, New York, um, Virginia, then some places in Florida, then many places in Michigan. They are very IMG friendly. However, I think the our students when they come, they have some sort of networking guideline, and they know exactly which places are, you know, uh, very IMG friendly and which ones are not. So I
Mhm.
think I wish that those guides could be available to all medical schools,
Yeah.
not only to AK.
All right. So, you mentioned that lack of networking is an issue that you commonly see. What advice would you give us as medical students to tackle this issue?
Well, I think you may need to reach out to people, make a web page which is for all medical schools and which is a guide to and entering you know positions in the United States. Also, many times I've seen the students are confused about which pathway to follow, the UK, the USA, Australia, and other places, and they're very, very confused. Like when I was in final year, third year, fourth year, final year, I did not know where to go. So I decided just to do fellowship in, from College of Physicians and Surgeons. And but looking back, I could have done a residency as well as a fellowship in the same time that I was able to pass FCPS. FCPS was very hard in those days, and the pass rate was less than 5%. Whereas in the US, the pass rate is more than 95%.
Right.
So nobody, gave me advice, and I did not have a lot of people who would tell me what to do, what not to do, and so this is the most common cause that we don't have a unified platform for students all over Pakistan. So that would be the best thing to do.
Okay. So we had a few questions from students that were asking exactly this. If they're in their final year of medical school or if they are exploring pediatrics, what are some things they should look for before picking a pathway? For example, US pathway versus the UK pathway versus staying in Pakistan. What do you think are important points that we should keep in mind before making a decision?
Yeah, so if you look at Pakistani pediatricians and pediatric specialists all over the world, there have been discussions about this. And what we found out that in the UK, the pathways are very long and they can take sometimes even 10 years, and the positions are not very um, open, they're very limited. You cannot reach the top. And I have had many friends. One prime example is Dr. Slim Reza, who was an attending in United Kingdom, and he left, did another residency in the US, and is now living very happily. So if you look, the US pathway is the best. From any objective standards,
Mhm.
the chances that you are able to complete residency as well as a fellowship and then return or stay in the US, the best pathway would be the USA.
All right. Have you noticed any change in the trend of people that have matched in pediatrics in the USA? Is there anything different that was not present before, but is present now?
I think the perception is the same that it's very difficult to get into the US, but the reality is that people do get in and they match all the time, provided they follow a proper way. They show they have their leadership potential. They are active in community. The other thing is that, as you know, USMLE step one used to count a lot, but now it is only pass and fail, right? And then I think there have been minor changes at where you can sit for the exams, the step one and the step two. And then I think the main emphasis now is on research, leadership, community work, how knowledgeable you are, rather than just very good at studies.
All right. Makes sense. Okay, so what should we expect in residency programs? We are familiar with university hospital programs versus community hospital. Uh, can you give us a rundown of what to expect in any of these residency programs?
So I have worked at, I have rotated through multiple hospitals in the US, and I think if you can get to the top tier, that would be the best. For example, Children's Hospital of Boston is one of the top best hospitals in the world, and I think 1 month of rotation at Children's Hospital of Boston is almost equivalent to working for 1 year in a uh, in a just like a normal regular hospital elsewhere. So it is so good because the attendings are very nice. The more educated you are, the more humble you become, and they're very friendly, very down to earth. That is one thing. Then you get to know all the details, get to see complex cases, the approaches, the library, how to access information. So this is better in the higher end hospital than. But the other thing is, once you do complete residency from any hospital, it is considered to be equal anywhere else. So ultimately, it doesn't matter. But I think if you go to for the higher quality hospitals, they are always better.
Okay, so do you know if Children's Hospital in Boston allows IMGs for rotations?
Well, you have to check. When I was there, I had a lot of difficulty. But then I took my degrees like FCPS, MCPS, and I showed it to an attendant who happened to be an IMG himself. So he was an Australian. So he was very impressed, and he said that, okay, you come and you rotate with, and that was free. But now I have heard that they charge a lot of money. So you can get in there, but you may have to pay a lot of money.
Got it. All right. So, a little bit about you. What made you choose this field?
Pediatrics, well, it was my father. Both of my parents are teachers, and so they were kindergarten teachers. So my father always wanted me to involve me in pediatrics, and he introduced me to Montessori, Froebel teaching methods. And initially I did not like pediatrics because uh, the college emphasis at King Edward was adult medicine all the time, and pediatrics was not looked on very favorably. But once I entered the field, I just loved it, and I love it even more every day, every passing day. So
That's good to hear. All right. So, what were your top favorite specialties when you were in medical school? Was it always pediatrics, or did you lean towards other specialties as well?
I was very good in surgery, so I was thinking that I would become a surgeon just like my other colleagues.
Mhm.
Uh, my so my very close friends went into ENT, eye, orthopedics, neurosurgery. So I
Mhm.
was very interested in those. But once I entered pediatrics, many of my classmates were surprised. And then, but I liked it and I just enjoy it even now.
Sorry?
Mhm. I said that I was interested in surgery,
Mhm.
and but ultimately I chose pediatrics.
So, you were talking about leadership and community work as something that is now more important with residency programs and matching. Are you,
Yeah.
are you familiar with any ways that medical students can be connected with volunteering or community work for pediatrics in like specifically pediatrics, not just community work?
Yes, what you can do is, for example, you can make a, like I said, there is a need to develop a website for pediatricians who are aspiring to go for higher um, studies and higher, like for residencies and fellowships. So you could do that. You could make a list of different um, IMG friendly places. There are so many program directors who are Pakistani. So you could make a list of those. You could add information. So that would be good for all Pakistani students. Okay, so that is one thing. Secondly, you see what is going on is the um, data. So what we need to know is what kind of problems are happening in civil hospital. What is the largest mortality? So where is the mortality? What is the morbidity? The other thing is for volunteering. For example, there are, in all hospitals where I have been, the sad thing is that the children are being taken care of very well, but the attendants, the relatives are waiting outside. They have no place. Most of them have no cover on them. The other thing I've noticed is very painful is that there are no dedicated restrooms, bathrooms for females in any of the hospitals. So the bathrooms that they even meant for ladies, they are sometimes taken over by men. And the other painful thing is there's no soap. So I think I I love the medical students because they can bring out bring about many changes. So this would be like social setup, just you know supplying soap. But the problem with the soap is that soap gets stolen many times, and people they can take away, and it has to be something like a sustainable project. So if you go, there's no soap. They will be using very high tech antibiotics, meropenem, vancomycin. You will go to different lectures, conferences, and you will see people are talking about very high tech uh, antibiotics, but they are not like they don't know the reality. Ground reality is that people are very poor and they leave against medical advice for many causes, for many reasons. And one of the biggest reasons is there is no good lodging place for the attendant. Now, somebody um, comes from a village to get their child treated, right? And they have to bring all of their family with them because they can't leave their um, adolescent girl at home, right? In the village. So they have to bring everyone. So these are important things. So sociological factors and improvement in that is a very important thing.
All right. Thank you so much for that. Just gonna check if there were any more questions, and then I'll open a question and answer for the audience. One So can you share any personal challenges that you met during your pediatric residency matching or afterwards? Is there any challenge that you can share with us?
Yeah, the biggest challenge when I came was the electronic medical record. So we were doing all paper charts. So when I came, I didn't know that I had to refresh the screen. So there's a button where you refresh the screen and you get to know the new lab values. So whenever they ask me what is the creatinine, I was telling them the old value. So that was my very first month. And I was put under probation because of that, because I did that again and again. And the other problem in the first month was that I was not very familiar with the three programs, the Pediatric Advanced Life Support Program, the Basic Life Support Program, and the Neonatal Resuscitation Program. So these were my weaknesses, and I'm glad to note that nowadays medical schools are doing that. Are you doing all three? Or no?
For electronic medical record, we do not have something yet, but yes, we do have an organization, First Response Initiative of Pakistan. We do allow certifications, etc., for neonatal resuscitation and some components of pediatric life support. But the ones from America, the ones that are certified, those have not started yet.
Okay. So what happened was the other thing is that I was able to recognize my um, weaknesses, and in the third month, I was the resident of the month. So I was, I rose to the top very soon, and I covered everything. So now, and I've been a physician champion for different electronic medical records. The other thing I did was I became one of the very first users of the artificial intelligence. So we have a program in which we talk with the families. And when we talk, like you're talking and I'm talking, I will also say that I will examine the patient and the pupils are equal and reactive, nose is normal, throat is normal, neck is suffered, lungs are clear, constipation bilaterally, cardiovascular S1 plus S2, no murmur, and the left tympanic membrane is swollen and red. Assessment is left otitis media, and so it will transcribe everything into a note. So I have been one of the very first users, and so that has been very rewarding. And everybody asks me now how to use that. And I've also been a physician champion for Epic and other electronic medical records.
That is amazing to
So
hear.
I turned my weakness into a strength.
Yes, that is most important. Can you talk a
And
little?
also I teach NRP program.
Mhm.
So NRP has three levels. One is a provider level. The second one is a mentor. And the third one is a mentor leader. So I'm on the top level.
Nice. Mentor leader. Can you talk a little bit about the AI use that you just discussed?
Yes, so the Henry Ford system, health system is one of the first in the country which has collaborated with Microsoft, and they have a artificial intelligence program in which we turn on our dedicated phone. Like, let me show you this is my work phone. Can you see it,
One sec.
everyone?
Yes.
So this one has got a program which is built in. And when we go into the room, um, this is the Epic program.
Mhm.
And so I have two roles. I'm both an ambulatory physician and inpatient physician. So I
Mhm.
choose my role, and then I open up the Haiku app, this one,
Mhm.
and then I turn on the program. The program listens to first I ask permission from the mother and or the father, and then when they say yes, then I turn it on, and then all we talk, it comes out very nicely in the note. I don't have to type anything.
Got it. All right. Thank you for that. Just gonna look for any other questions. Okay. So, are there any research projects that you have contributed to?
Yeah, I have done research in acute renal failure and um, urinary tract infections, antibiotic prophylaxis, and yeah, mainly these are the ones.
All right.
Then I've very early days of my medical school, I did zinc study in uh, um, uh, conjunctival swabs for different illnesses.
All right. Are there any illnesses that you commonly encounter in the United States? And if so, what are things that you can advise to prevent these illnesses?
Well, the common illnesses in the United States are viral, so there's not much we can do. But one of the exciting advances in RSV is the RSV vaccine, which is not exactly a vaccine, it's a preformed antibody. The other thing is that um, the pregnant mothers, they can get an RSV vaccine also in the last few weeks. And that is an actual true vaccine, which leads to the formation of antibody. So if the mothers they get that antibody, the babies they don't need the preformed antibodies. But if the mothers have not had that, then we give a shot of the RSV preformed antibodies to the babies, and that is very good because RSV is the most common cause of hospitalization and morbidity in US population.
Okay, perfect. Thank you so much for that. That wraps up our questions. I think there's just one more. So in general, what advice would you give us as medical students? What are things we can do right now that are most important? I think you discussed quite a few of them, but if there's anything missing, please let us know.
Yes. So I think I congratulate you for making this book.
Thank you.
It's very important that you took a lead. It's recognized by the American Academy of Pediatrics, and I will talk to the executive committee that we need to have a book for students, and I'll mention, all of your some things that you're doing, and if you can send me some more information, that would be nice,
Sure.
and that you are also interested in doing research. So you have to build up your positive resume. What it means is that you have to see what else is lacking in Pakistani society or culture or hospitals, right?
Mhm.
And then try to work on that. Secondly, I think never forget your country. We have to give back every day, every moment, every hour. I think of Pakistan
Mhm.
and the less fortunate among us, and it's very disturbing to see that the climate now is a very um, important player in children health because there are a lot of smog in Lahore and I went there and the index was very high. So the children are being exposed to that. Secondly, population explosion is terrible, right? So these are big challenges, and I think you should be involved more, and be very, very bold in exploring all the venues. Think of that, don't think that you are behind anybody else because Pakistani students are the world's best, one of the world's best, and we can do anything, achieve anything.
Perfect. Thank you so much for that. I'm just going to wait 2 minutes. If any participants have questions, please send it in the chat box. And then after 2 minutes, we will shift gears.
I would like to know about a few of the students who are here, if they can introduce themselves also.
Okay. I will ask first if the Student Interest Group of Pediatric Executive Council members could introduce themselves.
Hello, Assalamualaikum, Dr. Kamal. My name is Habiba Mohsin, and I'm a final year medical student at Dow, and I'm the General Secretary of SIGB.
Thank you.
Feel free to open your cameras if you'd like.
Okay, let me ask. I see Knut Irfans. So can you introduce yourself? Okay. How about Noor Fatima?
Hello, sir. Thank you so much for being here. It was a lovely session. We get to talk about so many things with you. There were so many queries. My name is Noor Fatma Suri. I'm a final year medical student at Dow Medical College, and I'm the joint secretary at SIGPay.
Inshallah. Hadika,
I believe Hadika is a participant. Go ahead, Hadika.
no problem. Sana, Riyaz,
Assalamualaikum, Dr. Kamal. I'm Sana Razawan from second year MBBS student, Dow Medical College. It's a nice session and nice to meet you.
thank you. Okay, I think that's it. I'm very happy to see this wonderful group. Okay, and in future we can do some more interactive sessions. Like I sent you some on UTI, hypertension,
Yes.
and I have a lot of lectures on different topics, and we can go over, some topics whenever you have time, right?
Yes, absolutely. Whenever you are free, we would love to have sessions. We
I love medical education, and I'm passionate about it. I'm available any day.
Okay, perfect. We will try to have sessions before January because January is prep leave for all the students. So we'll try to do as much as we can, and then we will resume in March, inshallah.
We can even do 15-minute session if that suits you, because we can do quick in and out. So I do sessions like these with the student interest groups of pediatrics from Michigan State, Wayne State, and what they do is they bring up they bring cases. Now the cases are different, but they are like very new contemporary cases, and like published in, say, November. For example, Peds in Review, another very interesting cases. So what they do is they present it. Usually, the sessions are usually at least 2 hours long, 2 or 3 hours long, and they present up to three cases. Okay, and they 3 or 4 cases, and they are very latest articles, and they do PowerPoint presentations, but they send out a PDF of the article beforehand, what they are going to do. Then the faculty comments on those topics, and then finally the faculty will present some topic of interest as well.
Mhm.
So this is what they do, and they meet usually around at least once a month, once every 4 weeks,
Okay. We can
depending on different colleges.
Okay. What we can try to do is we can try to have weekly sessions, maybe half an hour long sessions, and we just talk about new cases, or we can talk about case reports that are in civil. Any one of those, whatever works for you. And inshallah,
Okay.
we will go ahead with that. I believe
Yeah.
Filza has a question. Go ahead, Filza.
Assalamu alaikum, everyone, and Assalamu alaikum, Dr. Khalid. Am I audible?
Yes.
Yes, of course.
Okay, Dr. Khalid, that was a wonderful, wonderful session. I learned a lot from this session. And I'm a fourth year medical student at DMC, Dow Medical College. And from my third year, I had my first rotation in PEDS. So from that time, I knew that I wanted to, join PEDS. I really loved the atmosphere. I felt really happy around children. But then there's this thing now that a lot of people are competing for the USMLE pathway, and there's a lot of peer pressure that people pressurize you not take the specialty of PEDS because it's very low paid. It's especially in your family, people do not really like the idea of joining pediatrics. So how to deal with that? That is my first question. And secondly,
So
I
your
wanted to know.
your question is that how do we deal with the fact that it's a low paid specialty, correct?
Yes.
Well, the thing is, that after 20 years, I am doing extremely well, okay, in many respects. I'll tell you how. So many of the people who were with me, they went into cardiology. They are richer than I am, but Allah has blessed me with a lot of good things. Like, for example, we have three daughters, and they are doing very well. Number one, they are all married. Number two, they have very healthy, beautiful children. So I'm a grandpa of six, and then our house is paid off, our cars are paid off, and I am able to help out so many people. So I have always had more money than I need. Okay. So I have always been helping. I have the upper hand, not the lower. So many of the people I know, they may have lot more money, but they're not using it. They are keeping it. They keep on looking at stocks and bonds, and they are not able to help other people. So I feel I'm very happy and very accomplished. So maybe that will answer your question, that I feel richer than many of the people who have more money, but they're not like as rich. Okay.
That's
I don't know how to
that's very
yeah.
inspirational, and that's exactly my answer to my friends. Because I feel the sense of satisfaction is the most expensive thing that a person can have.
Yeah.
And my second question, Dr. Khalid, is that when I'm looking around, going into hospital in civil, looking around the condition of our people in Pakistan. I feel a sense of I feel a little bit guilty of pursuing the USMLE pathway, that 4 to 5 years of my youth would be spent outside serving other foreign country resident, and I wouldn't be able to serve my own country. And majority of the people I have talked to who are pursuing medicine in the US, they're of the opinion that nobody returns from the US once a person settles there, once a person is a resident, once he has done his fellowship.
Yeah.
Very few doctors actually return to Pakistan to serve the underprivileged.
That's a very good question. So the answer is that when you become a pediatrician, you don't only love Pakistani children. You love American children. You love um, Christian children. You love Jewish children. You love all children, because children are all our future. Okay, so that improves and broadens your oversight. Now I have children who are Hindus, they're black children. They come, they hug me and they love me and they say we have to see Dr. Kamal. So they won't go to any other pediatrician. I was in a clinic in Lahore, and the attending started to push the stethoscope right away without even trying to play with the child. The child was so cute, and I was just like astonished. And then I was trying to, smile at the big child, and the child started to, um, you know, smile at me. And then I picked up the child, and the mother was so amazed. She said that he never goes to anybody else. But it's the love for children. So different people behave differently. The other thing is, when I founded Apna Peeps, all of the Pakistanis, they are very much, um, uh, they very much remember Pakistan, and they want to do something for Pakistan. And there are people who have done even more than I have. So this is not true to say that when the Pakistanis, they go out, they never care. We always care, always think. Very few people, they they don't. But most of the people, if you come and see our family, it's grown and growing and grown a lot. Okay. Thank you.
I agree. Thank you so much, Dr. Khalid. Thank you.
Kunut, I believe you have a question. Go ahead.
Assalamu alaikum, sir. Am I audible to you?
Yes.
All right. So, sir, you called my name that time and I wasn't able to open the mic. I am able to right now. So, sir, first of all, thank you so much for giving us time and it was a great session. I am basically fourth year medical student at Dow Medical College, and I'm honorary secretary at SICP. I'm quite passionate about pediatrics. Like I'm the only one in my clinical group who wants to pursue pediatrics in the United States. Specifically, these neuro. So, what do you think? What's the scope in US about peds neurology, and what are some unique cases that you have seen over there?
What was the second part? What is the scope of pediatric neurology, and what was the other one?
What are the cases, some interesting cases that you have seen recently over there?
Sorry, I didn't understand. Again, one more time.
So I said that what is the scope of peds
Yeah,
neurology
I
in
got
the
that.
US?
I got that.
Yeah.
Mhm.
And what are some interesting cases, some recent cases that you have seen over there?
Okay, so pediatric neurology is a very, very interesting field, and many of my friends are in that specialty. And I think there's a lot of new advances that are going around. For example, we take care of seizures, epilepsy. There are different types of epilepsy. Some of my medical students have done excellent presentations on types of epilepsy like frontal lobe, temporal lobe, early onset, juvenile, late onset epilepsy, progressive epilepsies, static epilepsies, epilepsies with characteristic MRI findings. So what I do is I give small projects to my students, and they come up with very nice presentations like febrile seizures. What is new in febrile seizures, right? So what are the channelopathies? So some of the interesting cases I've seen is one family in Michigan. You clap very loudly and they fall to the ground. Anyone can answer this question? What is the condition called? You clap, and with the sound of the clap, they fall to the ground. Anyone?
Is it something like narcolepsy that has the catatonia?
You are very good, very close, but it's not that. Okay, what is narcolepsy? Leno?
Narcolepsy is excessive daytime sleepiness,
Correct.
and that also has catatonia. Basically, any surge of emotion will cause the muscles to
Yeah, but it's the sound that causes them to drop down. So it's one of the channelopathies. It is called hyperacplexia. Hyperacplexia. So hyper is HYPER.
Mhm.
Aplexia is
Mhm.
EKPLEKSIA. The second patient I would share is this was a 14-year-old girl. She started having abnormal behavior, depression, and then she had some um, um, uh, sensory phenomenon. Then eventually she started having seizures. Her conscious level had deteriorated, and then we did a spinal tap, and we found out that she had anti-NMDAR encephalitis. Have you heard of that? Now, what is the association in the abdomen? What will you find?
Ovarian tumor. I believe.
Yes, very good. Teratoma. Teratoma. Excellent. So we found that she had teratoma, and then we put her on bleomycin. And with the bleomycin, she developed a rash. So can you describe the rash with bleomycin?
Could it be like petechiae thrombocytopenia or?
No, no, no. There's a very characteristic rash that you should look up. Okay. So she developed that rash. So that was another interesting case. Okay. The third one was a boy, 14-year-old boy who went upstairs and, flew kites for a very long day. He came down and started swearing at his mother and father. So it was very unusual for him, abnormal behavior and psychosis. And so he developed severe abdominal pain and he passed red colored urine, but there were no red cells in the urine. Diagnosis?
I'm not sure, sir.
Again, abnormal behavior, severe abdominal pain, red colored urine, but no red cell. Very high blood pressure.
But no what?
No red colored urine, but
Uh-huh.
no red cells in the urine. No red cells in the urine. Acute intermittent porphyria.
Oh, okay. Okay. Got it.
So I think these are enough for you. I can share more cases, but like these are pediatric neurology is very, very interesting.
Yes, sir, I can tell. Thank you so much for answering my question. Thank you.
All right. So sorry, go ahead. Do you want to
Yeah,
say?
one more advice is that try to help out first year medical students. So try to show them cases
Okay.
because they are reading only books. If you show them clinical cases, then involve the teachers. Like, and say we want to, show them some cases of jaundice, for example, neonatal jaundice. So Zainab, I have a question for you, quiz question. I hope you don't mind. So you are going to explain jaundice to a mother who has very little scientific knowledge. How will you explain jaundice in the newborn?
Jaundice in the newborn. Urdu mein bolu? Or should I
जी
speak?
उर्दू में
Okay. So, sorry, the child is just born? In
ये
the scenario, is the child just born?
बच्चा पैदा हो गया येलो है अब आप उसको कहते हैं कि जी यरकान है वो कहती है कि मुझे यरकान बताएं क्या होता है ये पीला रंग क्या होता है
तो जो पीलिया इस बच्चे में है और जो हर बच्चे में होता है वो इस वजह से होता है कि आपका जो खून है और इस बच्चे का खून में मिल जाता है और जब वो खून निकलता है बच्चे के जिस्म से तो एक पीला रंग दिखता है और ये इस वजह से भी हो सकता है कि आपका जो अपना दूध है जो आप पिला रही हैं वो काफ़ी नहीं है बच्चे में तो दैट्स ब्रेस्ट फीडिंग जॉन्डिस और अगर ये पीलिया बहुत बढ़ जाए तो ये दिमाग में जाके जो है दिमाग की कुछ जगहों को बुरा तरीके से अफेक्ट कर सकता है
गुड अटेम्प्ट लेकिन इसमें फिजियोलॉजिकल जॉन्डिस को नहीं बताया गया राइट तो उसको इस तरह कर सकते हैं कि लेट मी से इट इन इंग्लिश कि द जॉन्डिस हैपेंस इन nearly all newborn babies and when the babies are in the belly they have a lot of red cells too many red cells to capture the oxygen because the mother is getting some oxygen and the baby then gets the oxygen in order to capture that they make a lot of red cells when the baby comes out they don't need that many red cells. So some of the extra red cells, they are destroyed. And those red cells, when they are destroyed, that leads to the yellow. So not all yellow is bad. The jaundice helps kill bugs and it acts as an antioxidant. However, when it is too much of a yellow color, then it can cause more damage to the brain, like you said. ठीक है तो आप इसको उर्दू में थोड़ा सा इजी कास्ट के बता सकती हैं तो सबसे जरूरी चीज है कि आप पेशेंट के साथ जब मदर के साथ बात करती हैं तो उनको कैसे आप इजी लैंग्वेज में बताएं इसकी आप प्रैक्टिस किया करें कि पेशेंट के साथ प्यार से कैसे बोलना है उसके साथ सिंपल लैंग्वेज में कैसे बताना है क्योंकि अगर आप बताएंगे बहुत बड़ा इंसाइक्लोपीडिया तो उसको समझ ही कुछ नहीं आया राइट
सही all right just one question that I had if you see IMGs matching in pediatrics in the United States, is there any common issue that they face in their residency due to being an IMG? Is there any lacking?
वो यही सारा चक्कर चलता है ना कल्चरल इश्यूज जो है कि हाउ टू एड्रेस और कैसे बात करते हैं कैसे क्या करते हैं तो जिसका कोई एक्सपोजर नहीं है यूनाइटेड स्टेट्स में उसको तो बहुत डिफिकल्टी आती है ना क्योंकि शुरू में लेकिन वो जनरली फ्यू मंथ्स में ना दे कवर ठीक है तो कई चीजें हैं जो पाकिस्तान में कुछ लोग शर्माते रहते हैं तो you have to be bold and present your case कि ये चीज है तो कुछ महीने में ना they learn to do it.
Okay. And
It's not a big deal. अब
okay.
मैं आपको एक एग्जांपल देता हूँ कि मुझे नहीं चीज पता थी जब मैं अमेरिका गया तो हमें हम डालते थे खत अपने तो हम जाते थे पोस्ट ऑफिस में तो मुझे बड़ी देर बाद पता चला कि आपके जो अपार्टमेंट के बाहर छोटा सा एक पोस्ट बॉक्स लगा होता है उसी में आप डाल दें और उसकी डंडी लाल डंडी को ऊंची कर दें तो वो डाकिया वहां से ले जाए तो मुझे पता ही नहीं था मैं बड़ी देर तक जाता रहा तो इस तरह सिंपल चीजें हैं दूसरे आप ये देखें कि अगर पुरानी गाड़ी लेंगे तो पुरानी गाड़ी में ना अक्सर आपको पैसे बड़े लगेंगे रेजिडेंसी का टाइम जाया होगा तो अगर आप नई गाड़ी ले लेते हैं जो बेहतर है और बड़ी फैसिलिटीज मुहैया होती हैं तो आपको ये कम से कम गाड़ी की प्रॉब्लम नहीं है
Sahi. Perfect. Thank you so much. One last thing, like I am interested in pediatric infectious disease. I think there are some
Yeah.
here that are also interested in that same specialty. Is there any facility that can be available for us, like research ke lihaz se or elective ke lihaz se? Is there any help?
मल्टीपल है वो आप उसको पीडियाट्रिक इन्फेक्शियस डिजीज का जो ग्रुप है उसको आप अप्रोच कर सकती हैं कि जी मुझे चाहिए तो दे आर डूइंग रिसर्च ऑल द टाइम नादिया
part of-
कुरैशी इज वेरी गुड नादिया कुरैशी इज इन लोयोला University in Chicago. She's very good. She's an Aham graduate.
Mhm.
She's very interested in teaching, training, mentoring, involving students in research.
Okay, so she's part of APNA. This is an APNA organization.
Apna PEDS, जी.
Okay.
Apna PEDS की
Yes.
one of the earliest founding lifetime members.
Okay, mashallah.
जी.
All right.
Sir,
उनके
what's
जो
the name you
father थे,
mentioned?
उनके father जो थे, he was one of the very first people who established IT in Pakistan. So very, very, these people, they love Pakistan. They help Pakistan all the time.
Sir, what's the name you mentioned? Nadia?
Qureshi
Okay.
All right.
from Loyola in Chicago.
Perfect.
She's a pediatric ID. Very, very knowledgeable, very smart, very friendly, wonderful lady.
All right. Would you happen to have her email address or any way we can connect with her, or should we just go through
हाँ
the?
जी, एक मिनट मैं अभी आपको बताता हूँ
Okay.
ये है कि N Qureshi at lumc.edu.
Could you please spell it out?
जी N as in Nadia, then Qureshi is QURESHI at the rate of L as in Lahore, U as in umbrella, M as in Multan, C as in Charlie, .edu. E elephant, D David, U umbrella.
Perfect. Thank you so much, Dr. Kamal, for that and for this amazing session. I'm just going to wait 1 minute. Does anyone have any other questions for our speaker?
Filza का कुछ question है, Filza.
No, sir, I just wanted to appreciate the time you have given us. It was a wonderful session and we learned a lot. Thank you so much. And I'm looking forward to more sessions with you.
ठीक है, इंशाल्लाह.
All right. I believe everyone has their questions answered.
Okay, फिर. अल्लाह हाफिज.
All right. Thank you so much. Jazakallah khair. Allah Hafiz.